This information sheet briefly explains the cause, effects and management of spinal muscular atrophy, SMA, type 1. It is for the families of children diagnosed with SMA type 1 and may also be useful for healthcare and other professionals. More information on daily care is available in the leaflet, Looking After Your Baby with SMA Type 1. Further information on SMA Type 1 and sources of support is available from SMA Support. UK's online route map for SMA Type 1. SMA Type 1 is a complex condition. There is a lot of information to take in and every child with SMA is different. What is spinal muscular atrophy? Spinal muscular atrophy, SMA, causes progressive loss of movement and muscle weakness as a result of muscle wasting, atrophy. The condition may affect crawling and walking ability, arm, hand, head and neck movement, breathing and swallowing. SMA is often grouped into types based on the age at which symptoms first appear and whether a child will achieve their physical developmental milestones, including the ability to sit, stand or walk. There are 4 main types of SMA. In types 1, 2 and 3 symptoms begin in childhood. Individuals with SMA type 4 have symptoms that begin in adulthood. This is sometimes also called adult-onset SMA. Although SMA is often referred to by these types, they are not rigid categories. There is a wide spectrum of how severely individuals are affected, both between the different types of SMA and between children, young people and adults within each type. What causes SA? Usually, signals from the brain are sent via the spinal cord along the nerve cells and through to muscles. This makes it possible for us to consciously contract the muscles and to make them move. SMA affects a particular set of nerve cells called lower motor neurons which run from the spinal cord out to the muscles. The lower motor neurons carry messages that make it possible for us to move the muscles used to crawl and walk, move our arms, hands, head, neck, and to breathe and swallow. For our lower motor neurons to be healthy, we need to produce an important protein called the survival motor neuron, SMN, protein. Our ability to do this is controlled by a gene called survival motor neuron 1, SMN1. We all have 2 copies of this SMN1 gene, one from each parent. People who have 2 faulty copies of the SMN1 gene have SMA. People who have 1 faulty copy of the SMN1 gene are carriers of SMA. Carriers usually do not have SMA or any symptoms of SMA. People who have 2 healthy copies of the SMN1 gene do not have SMA and are not carriers. SMA is passed from parents to their children through their SMN1 genes. When 2 people who are carriers have a child together, their child may inherit 2 faulty SMN1 genes, one from each parent. If this happens, then their child will have SMA. Having 2 faulty SMN1 genes means that a child is only able to produce very low amounts of the SMN protein. This causes the lower motor neurons in their spinal cord to deteriorate. Messages from their spinal cord do not efficiently get through to their muscles, which makes movement difficult. Their muscles begin to waste due to lack of use, and this is known as muscular atrophy. In addition to SMN1, we possess a second gene that is able to produce some functional SMN protein. This gene is almost identical to SMN1 and is called the SMN2 gene. However, SMN2 only makes a small fraction of functional protein, about 10%. For more information on the inheritance of SMA and how SMN2 is linked to the severity of an individual's SMA, please see our leaflet, The Genetics of Spinal Muscular Atrophy. Diagnosis. The current internationally accepted standards of care for SMA describe the clinical classification of SMA type 1 as a condition with symptoms which begin at age 0 to 6 months and where the physical milestone of sitting unsupported has never been achieved. These standards and classification are currently being reviewed. SMA type 1 is the most severe form of SMA. Approximately 60% of children 5 diagnosed with childhood-onset SMA have SMA type 1. It is sometimes referred to as Wernicke-Hoffmann disease, or severe infantile SMA. The symptoms of SMA type 1 usually begin from birth or within the first few weeks or months of life. Sometimes SMA can affect babies even before birth, and mothers may remember that their baby had become less active towards the end of their pregnancy. Generally, the earlier the onset of symptoms, the more severe the condition. Sadly, SMA type 1 is a life-limiting condition. It is not possible to predict accurately life expectancy for babies diagnosed at a very early age. However, without intervention, this is usually less than 2 years. A doctor will diagnose SMA type 1 after taking a medical history, physically examining a child, and by taking a blood sample for DNA testing. The blood sample is tested for a deletion mutation in the survival motor neuron 1, SMN1, gene on chromosome 5. The result of this test is usually available within 2 to 4 weeks, but can sometimes take